So welcome, good morning, and thank you for joining us for the fourth session of the Health Equity Capacity Building series. My name is Margaret Shield. I'm the coalition organizer of Washington Breeze, and I use she, her pronouns. Thank you so much to each of you for being here today. Please use the Zoom chat to share your name, pronouns, organizations, anything else you'd like to share to introduce yourself to the group today. And as I start our meetings, I like to offer this land acknowledgement that we here in Washington State gather on the lands of the Pacific Northwest Coast Salish and the Plateau tribes. We're recognizing their invaluable contributions to our state, history, economy, and culture. This acknowledgement is a reminder to support tribal sovereignty, self-determination, and upholding government-to-government relationships. And these commitments are part of our effort to form a more just and equitable society. So for the next year, we are partnering with the Center for Black Health and Equity on this series, where we are working to grow together, to learn, to diversify participation in our coalition, and create an action plan to work towards ending the sale of menthol and other flavored commercial tobacco products. And our vision and mission of Washington Breeze is to work broadly on all the harmful impacts to our communities from commercial tobacco use, sales, and industry tactics. We work on policy systems and environmental changes to eliminate disparities, improve community health. We have kind of three broad strategies that our coalition uses to accomplish that. We build our capacity, we work to increase understanding, and we amplify our voices for policy and systems change. And then the thing that I need to explain about our coalition is, because of the funding sources we have, we work on policy change education, but we don't lobby or organize lobbying activities in our meetings because our federal and state funding sources currently prohibit that. Some of our members can and do lobby, and we understand that. Some other members we have cannot lobby, and we are a forum where they can raise their voices for policy change. The spaces you can work in depends on the type of organization you're in and where that organization draws the line for you. So what I'm calling policy change education covers education, and then we also go into that advocacy space carefully to make sure we don't cross into lobbying. But educating about issues and problems is something everyone can do, and then advocating to link our education to a policy solution, like how ending the sale of flavored tobacco products would protect communities and save lives. We do that too. And by working in that policy change arena, we can do a lot to raise awareness about these problems and solutions through our communications, our materials, our website, and the outreach of all of our coalition members. And we now have a purpose statement for this particular project. This was recently finalized by our steering committee. So we're working together to develop a strategic education campaign about ending the sale of menthol and other flavored commercial tobacco products. And we want to do that too in the context of building an equitable prevention and cessation infrastructure in our state and working toward those commercial tobacco-free communities. So with that, thanks for sitting through that introduction, and hopefully that explains a bit more about what we're doing. And now I'm really excited to turn it over to Bryce Kahari. Very excited that Bryce can be here today from the National LGBT Cancer Network.
Absolutely. Thank you so much, Margaret. I'm so excited to be here. I want to first say congratulations to you all as a coalition. You're approaching your 1 year. That's so exciting. I hope that you're able to take a little time to just reflect on how much you've accomplished over this last year. Also, I want to thank the center and especially Ashley for all of the hard work that she has already been doing, all the hard work you all as a coalition have been doing. And I'm so grateful to be here to chat with you today. You can go to the next slide. And you go to the next slide. We're going to start with just a quick introduction. My name is Bryce Kahari. I use he, him, his pronouns. I'm the Training and Technical Assistance Manager at the National LGBT Cancer Network. I work a lot in pretty much solely on our CDC-funded grant where we get to work with a lot of coalitions like you all, and also different state departments of health and LGBTQ plus orgs across the country around addressing tobacco and cancer disparities. My, I guess, work in tobacco control has spanned probably about a decade. I started as a youth advocate, and I've gotten to work with a number of different organizations, and so I'm really excited, to be here to chat with you. Also, my passion is health equity, and so I'm really, really, you're going to see that a lot during this training. And I am based in a very humid Mississippi. You can go to the next slide. So just a quick, I guess, preview of our agenda today. We're going to move quickly. I'll first kind of talk a little bit about who we are at the National LGBT Cancer Network. Just then, kind of before we dive into tobacco, we have to kind of set the stage, right? And we have to talk about what is going on within the LGBTQ plus community. We're going through an unprecedented time right now, especially in reference to legislative attacks. And then we're going to talk about definitely a lot of our, community. It includes a lot of folks who are BIPOC, and so we're going to talk about that as well as tobacco targeting, and then kind of going to get into some engagement strategies and wrap up with some resources that we have at the network that may be able to help you. You can go to the next slide. And the next slide. So just kind of just introducing who we are at the network. We kind of focus around 3 buckets. And so educating. And so we do a lot of community education. We know that the LGBTQ plus community, does have increased tobacco use, does have increased cancer disparities. And so we focus a lot on educating, especially, other organizations who aren't LGBTQ plus specific, really educating them on our disparities and also ways in which they can engage our community. We also do some advocacy work. A lot of times this is, very much so within the cancer space, but also within tobacco control too, different sign-on letters and things like that. And then also trainings. We do a lot of trainings with public health organizations, clinicians, providers, state health departments across the country. You can go to the next slide. We are one of 8 national disparity networks, along with our amazing sibling network here, the Center for Black Health and Equity. And so we, this kind of national network approach, is for preventing and controlling tobacco-related cancers in special populations. And so we really assess the field to identify knowledge gaps. We offer training. We create knowledge pieces and things. And we have a lot of resources and partnerships that we'll talk a little bit about today, but also you all will get a ton of resources and links if you want to stay connected to us or the work that we're doing. You can go to the next slide. One of those things is our amazing newsletters. I mean, we have an amazing, incredible comms person who puts together these phenomenal newsletters that look like this that I could never put together even on my best day. And so we are definitely going to be sending out some links for you to join our mailing list so you can stay updated on the work that we're doing at the network. And next slide. Included in those things will also be our online resource library. It is, I like to say, a one-stop shop for everything. We really feature a lot of the work that we've done, but also a lot of work that our partners have done and are doing. You can go to the next slide. And there's also, of course, an opportunity to join our network, which, like I said, will be included in the links. And so this is, we offer specific, unique resources to our organizational members, which is completely free. And so definitely, if you as an organization want to join us as a member, feel free to fill that out in the links that you all will get. You can go to the next slide. And then the next one after that, we're going to just start by kind of framing the issue and framing the LGBTQ plus community. So according to Gallup polls, 7.1% of Americans now identify as queer, right? So this is the first time ever, right, that we are seeing this number of folks self-identifying as queer, which is an amazing, amazing thing. And so as you can see by kind of, the gravity of that number has really expanded over the past decade, it's really doubled. And this is due to a lot of factors. The increased visibility and representation in media is definitely one thing. But also Gen Z Americans, which I'm I'm proud to be part of Gen Z as well. Roughly 21% of Gen Z who have reached adulthood now identify as LGBT, right? Which is phenomenal. It's really double the portion that millennials are identifying. And so one of the big takeaways that I really want you to get from this is our population is changing faster than ever before. All right. And as a community, the LGBTQ plus community is a powerful and growing force, both in the United States and across the world. And so you are going to get left behind if you're not updating, if you're not improving, and if you're not ensuring that you can do everything to be inclusive of our communities. You can go to the next slide. Really, really, really important for us to talk about the extreme onslaught of anti-LGBTQ plus bills that we've seen floating within state houses. We are seeing a huge, huge increase. I first started at the network in 2021, and that was the record year, right? We had never seen that many. Then 2022 came, and within the first within the first 6 months, we saw that record be shattered. And it was, I think, on month 2 or 3 of this year where we had already shattered the previous record that was set in 2022, right? And so the reason why it's important to talk about this is what our community is going through. If you're going to work within a community, especially one that has been underrepresented, that has been oppressed and marginalized, it's important for you to know what we're dealing with as a community. And we are dealing with especially LGBTQ plus folks across the country being attacked legislatively, our culture, bathroom access, availability of trans and non-binary youth playing sports. These things are important to know because that increases stress, right? And of course, that is going to increase how many folks are, going to even be using tobacco products. You can go to the next slide. Something else that we know is that a huge number of our community identifies as BIPOC, right? Which is Black, Indigenous people of color. So 24% of the general population within the US identify as BIPOC, but 42% of the LGBTQ plus population identifies as BIPOC. And so this is a really great reminder that in the work that you're doing, it is so important that you're approaching any work that you're doing in tobacco prevention and control from an intersectional lens. You can go to the next slide. Looking at youth, and so this is data from July 2021 by a study that the Trevor Project did, and so 71% of trans and non-binary youth reported that they have been that they've experienced discrimination, and 48% of LGBTQ youth identify as non-binary and or trans. It's really important that we first of all understand that this is what especially queer youth, but in particular trans and non-binary youth are going through. They're going through a lot of discrimination for being who they are, right? And being empowered, to live their, and be their truest self. And so all of this stress is going to have a negative impact on health. And, we have seen that, and we're going to start talking about how we've seen that within tobacco control. You can go to the next slide. First, though, we're going to take a quick peek in your state and really look at how many queer folks are actually in Washington State. And so this data is from the Williams Institute. And so we know that about 300,000 LGBT people, call Washington home. And so just to give you a kind of view or metric, this is the whole population in Spokane plus another 71,000, right? So that's a pretty large percentage of folks who identify as LGBT. You can go to the next slide. Also, something else that I want to know around language, if you ever hear me say LGBT, LGBTQ, LGBTQ plus, right? It's a lot around I'm using what the data says, right? And so when I'm talking about our population as a whole, a lot of times you'll hear me say LGBTQ plus, right? But sometimes the data doesn't always support and hasn't always been inclusive of our community. It's one of the big things that we are really encouraging folks to do is collect SOGI data, sexual orientation and gender identity data, so that we can have the data to make the best decisions about our community and learn kind of where the things that we need to address are, right? And so if you hear me saying LGB or LGBT or LGBTQ without saying the plus, you are, I'm doing that because that's what the data supports, right? And so when we talk about, LGBTQ plus folks who are racial and ethnic minorities, BIPOC folks, we're seeing that number be 29%, which is a bit higher than, as compared to the entirety of Washington folks who are, you identify as a racial or ethnic minority. So again, really important that we're addressing intersectionality. You can go to the next slide. So let's kind of go ahead and dive in on some of the tobacco targeting and kind of really frame the issue before we hop in. And so it's really important for us to first talk about Project Scum. So in 1995, the tobacco company R.J. Reynolds actually created a marketing strategy to target gay men and unhoused folks through advertisements and displays placed in communities and stores to boost the sale of cigarettes. And they called it Project Scum, which Scum stood for subculture urban marketing, right? But we know what scum means, right? And we're not going to delude ourselves. We know that they are specifically wanting to target us. This is how they think about us, right? And we know that we've seen increased efforts of different tobacco industries and tobacco companies wanting to pop up at our Pride events or wanting to give donations, right, to HIV/AIDS organizations. But, to be clear, you cannot be for our community if you are pushing a product that is going to harm or even kill us. Right? You cannot be for our community if you think of us as scum. And so it's really important that we recognize the level of targeting and the things that the tobacco companies and, e-cigarette companies are trying to do to kind of remarket themselves to show that they're an ally. We know the truth. You can go to the next slide. So kind of showing that marketing, so much of it was around menthol products. I'm sure many of you all know and have been talking about that menthol and flavored products does not affect every community equally, right? We know that we're seeing a huge number, right, of Black folks who are using menthol and flavored tobacco products, right? This is also true for LGBTQ plus folks as well. And so, really pushing menthol products was really very popular within, LGBTQ plus advertisements for those menthol specific products. And many of the ads really show kind of stereotypical ways of being coded as queer, like rainbows or the two shirtless men with their dog in the ocean. You can go to the next slide. We've seen that this is continued in reference to e-cigarette ads, right? And so they're kind of using the same strategy, but what they're really starting to do is really sponsor a lot of Pride events or other community events to really get people introduced to their products. And they're also starting to really use a lot of our culture, right? And so a lot of things like, drag queens and a lot of the language that really connects with queer folks, feel free to be yourself, right? And so they're really, really being inventive in how they're targeting our community. And that means that we have to be just as creative and inventive when we talk about ways to counteract this. You can go to the next slide. So, like I kind of already said in reference to kind of closing the piece around marketing, we know that tobacco companies are continuing to advertise at different Pride festivals and other queer community events. A lot of tobacco advertisements were even placed in gay and lesbian publications, and they really depict tobacco use as a normal part of life. I can tell you, being queer, that it is something that when you go out, you see it everywhere, right? I'm also you know, part of a state that is in Tobacco Nation, so I see that really even more. So, but it's very much ingrained within our community. And so a lot of the work that we're doing is to try to get LGBTQ plus folks to reimagine, what does a culture look like without tobacco control, right? That culture looks like a safer, healthier, more vibrant community who is able to live long and healthy lives without the damage that tobacco causes. And so a lot of the tobacco industry has really, like, you know, like I said, really pushing menthol product usage. We know that approximately 36% of LGBT smokers report smoking menthol cigarettes, compared to 29% of heterosexual and straight smokers. And so we see what, you know, this has had. And we know that, of course, menthol tobacco usage makes smoking, you know, easier to use and much harder to quit. You can go to the next slide. So we kind of talked about the background, right? How we got here, the different targeting, right? And so now we're going to delve into what the numbers actually show us. You can go to the next slide. So it's really important that we talk about, okay, we talked about the targeting. How does this translate in what we are seeing as effects? LGBT smokers are significantly more likely to smoke menthol products. As a community, we see more tobacco product ads than non-LGBT people. We know that, you know, this is data from 2021, 17.4% of gay, lesbian, or bisexual high school students currently reported using a tobacco product, compared to just 11.4%. You know, when we look at heterosexual or straight high school students, so we're even seeing this effect within youth, right? And so this is something that, you know, we know that we use more tobacco products than non-LGBTQ plus people. And we also know that as a community, right, we are under a lot of stress. And so unfortunately, when you are under a lot of stress, sometimes you don't make the most important and the best health decisions, right? But we also know that a lot of times, you know, in reference to tobacco, a lot of these products are really pushed to our community, like I said, at Pride festivals, but they're also very cheap and they're also very accessible, right? And so the work that we are doing within health equity, within tobacco control, is not just looking at, okay, how can we, encourage folks to quit using tobacco or to never start, but it's also to recognize that tobacco is a symptom. It is not the root cause, right? The root cause of using many of these tobacco products for many folks who are smoking is because of the added stress and there being a need to cope from that stress, right? And so if we start focusing on what we can do to address those social determinants of health, those social drivers of health, the more that we're going to be better in the engagement that we are doing, and the better we are going to be in listening to what LGBTQ plus folks, but people in general who are using tobacco, right, are saying. You can go to the next slide. And so looking at this, at the intersectionality, we know that as a community, LGBTQ plus folks, we're saying do not use tobacco equally across our community. And so we know Latinx populations tend to have the second highest menthol usage rates. We know that 70% of LGBTQ youth who smoke prefer menthol, right? Not surprising when you see those ads. And we know that a lot of people think that things like vaping is really a problem for youth, but especially when we look at kind of the intersection of LGBTQ plus youth who are also BIPOC, those rates of vaping are typically much, much higher. And we also know that this is affected, even though we don't have as much stats on trans and gender nonconforming communities, we do know that Black trans youth are more likely to vape than Black cis youth. You can go to the next slide. So a little bit more information around vaping. We know that youth vaping continues to remain a huge issue in the fight against tobacco and nicotine addiction. And this is especially true for the LGBTQ plus community. 1 in 4 LGB youth are using electronic vapor products. And so we know that there's also increasing evidence that vaping could even lead to youth, even starting to try cigarettes or both e-cigarettes and cigarettes, what we call dual use, right? And so there's really very much an impact for us to address flavors, but also to address the products that youth and young people are using today. You can go to the next slide. Looking at tobacco use in LGB communities, when we talk about queer health, so much of that is focused around things like HIV, mental health. And so there's a real lack of understanding, especially within our own community. But, just generally that tobacco use is not just something that we struggle with as a community. It is something that is taking our lives. It's a huge health issue for our community, and it's really important that we focus on it when talking about the larger queer health. And that's why it is so important for us to make these connections and intersections to intersectionality, but also how tobacco use is connected to a lot of other issues as well. Those social drivers of health. So when we look at the data, tobacco related cancer, that's one of the most important addressing as one of the most important health issues for our community. And it is still one of the huge reasons why queer folks are dying. You can go to the next slide. Again, we have very, very limited usage on tobacco use in trans communities. That's why we encourage folks, of course, to do more to look at and study SOGI data and collect that data. We know that trans communities typically have, up to 50% higher smoking rates. And it's really a lot of times the correlation that we make is that trans communities are especially vulnerable when we talk about having high rates of substance abuse, depression, HIV, social employment, discrimination. All of these typically correlate to a higher smoking prevalence, right? And so it's really important that even though we don't have some of that hard data on tobacco use in trans communities, it is important that we are focusing the work that we're doing on trans communities. And I would be remiss if I didn't acknowledge that unfortunately, many trans people in the US do not have health insurance. And this is due to a variety of factors like discrimination or not having a job that offers it. But that also increases, right, the ability of folks to be able to use, different healthcare plans and different, cessation interventions to be able to address their usage. We also know, and something that, anytime that I talk about trans communities, I'm always gonna bring up, we know that trans communities are also facing an unprecedented number, especially Black trans women, of violence within our community. And so it's also important for us, again, the work that we are doing in health equity is not just about tobacco. It is about all of the reasons why folks are having more stress, which is causing them to use tobacco as a coping mechanism. You can go to the next slide. So we love, I can sit here and talk about data all day long, and I do enjoy doing that, but I'm an artist. And so one of the things that I enjoy even more are people's stories. I think there's nothing more powerful than people's stories and people's narratives. We have a program called Out Proud Free that is really focused on collecting folks' stories. And one of those stories that I want to share with you today is one of my friends, Sam, who's a poet, artist, and educator in New York. And Sam says, I'm not cutting anymore, but I switched to smoking, which essentially did the same thing. Sam's story really highlights the intersection of tobacco use and mental health. Many LGBTQ plus people, like I said, don't have access to mental health care. And that's because, unfortunately, we've done a really good job in this country of separating mental health care for other forms of health care. And so if you're someone who is uninsured, right, and you are a queer youth or young person, and you're having to decide whether you're going to spend money on a therapy session, right, which could be hundreds of dollars out of pocket if you don't have insurance, or if you're going to spend a few bucks on a tobacco product that can temporarily take the edge off, we're seeing that a lot of our community is turning to that. And so the impact of mental health on tobacco rates is something that we always have to be aware of and talk about. You can go to the next slide. Okay, so we're getting into now the meat of the presentation. And so we've really framed the issue. We've talked about the targeting, we've talked about the data. And so now comes one of the most important things. So what are we going to do about it? How are we going to improve the engagement that we do, the work that we are doing with LGBTQ plus communities to ensure that they never start or that they stop using tobacco products? You can go to the next slide. And so one of the first things that I want to really talk about, is the importance of always engaging queer folks from the start. We talked to a variety of organizations who are saying, I really want to do more work with LGBTQ plus folks and we've already outlined this and this and this and that. And my first thing is, I'm like, oh, so it sounds like you all already have it figured out, but my next question is, have you talked to LGBTQ plus people? Are you involving queer folks in the discussions that you're having, in the planning that you're having? And a lot of those responses is no. They're trying to bring in queer folks in the middle of a project. And what this shows is that you don't value our community. You're not intentional about ensuring that you are involving us from the start, that you're valuing our voices and our perspectives and our experiences. And so if you're making a plan that you want to engage LGBTQ plus folks within the work that you're doing, making sure to include queer folks in the start of that and in developing, kind of the work plan to start is always going to be so much better. If you miss this step, a lot of times you're going to be trying to fit your ideas about outreach into a community that may or may not have the same needs and interests in what you're offering, right? And so it's so important that we are developing our work and our engagement and the work that we're doing, not just based on the data, not just based on the research, but also based on what these communities are telling us. Nobody knows about communities like the community members who are in it. Having a diverse group of queer folks inform the community engagement from the start is always going to ensure cultural relevance. And also organizations that really wish to engage a community, something that that we talk about at the network all the time. You're going to have to be prepared to kind of release some of the control around actions or interventions. You're going to have to be flexible, and you're going to have to look at how you can develop mutually beneficial goals around things that may not even always include tobacco. You can go to the next slide. And so one thing that I want to say is trainings like this are great, right? It is so important that we talk about education. But if you think that this is going to be a one and done thing, trainings are great, but we want to develop a attitude, a spirit of being a lifelong learners. And lifelong learners mean that we are going to have to understand that our communities are always changing because people are always changing. And so a lot of times the words in which we use to identify the specific challenges that we are having are going to continue to change. And it's really important that if you are wanting to work with communities, that you care about and you are continuing to be informed and educated on what the community is going through. We also encourage folks to get to know some of your local LGBTQ plus community centers. Community centers, are really often the lifeblood of really connecting LGBTQ plus folks around, movement engagement work, around, different health topics. And so in the resources, you're going to find center links, member directory, where you can find an LGBTQ plus community center within Washington State that you all may already be working with, or and also many that you may not have even known existed. But it's important to, as you're working to engage LGBTQ plus community centers, it's important that you understand they are structured differently than other health or public health orgs. And so there can be a huge range in the mission, the purpose, the number of staff. My goodness, we have worked with different community, different queer community orgs. And we're talking like 1 or 2 full-time staff, and they're talking about every topic under the sun that relates to health. So we have to be understanding of that as well. We have to be knowledgeable that that is something that we're going to run into. And a lot of times, even some of these are volunteer run. And so when exploring partnership opportunities, using the skills that you've already practiced on, in reference to advocacy, one of the most important things is to listen. Listen and let communities tell you how best to engage them, how best to do this work. And also know that the answer you might get when asked to work with communities is going to be no, or it's going to be not right now. And what is going to matter is how you respond to that. If you respond to that, well, I guess these communities just don't want to work with us. Like there's nothing that we can do. Something that I'm going to talk about kind of in the next coming slides is that there are a variety of reasons why folks could be telling you no or not right now, right? And so us saying, we understand, that's okay. We're not going to stop engaging with you. We're not going to stop coming to your events. We're not going to stop reaching out. We're not going to stop showing that we care about you. We care about your perspective, and we want to engage you in our work because we know that you have valuable things to say. You can go to the next slide. So continuing on with talking about different engagement strategies, using trusted organizations is really important, but it's also really good to think outside of the box, right? And so a lot of times, looking at colleges and universities is a really, really great thing to do. Also when you talk about LGBTQ plus folks, some other things to really start to consider, HIV/AIDS service organizations, different behavioral health organizations. We have seen and worked with even some organizations like in Texas who are LGBTQ plus youth organizations. And so we know that's important as well. And they're, they are few and far between, but they are out there, LGBTQ plus affirming different faith organizations and communities. For a really good example of this, we were working with Alabama, and something that came up in our work with them was that we quickly found out that a lot of the mainstream LGBTQ plus orgs within the state, they were not perceived by BIPOC and especially Black community members as inclusive or addressing the needs of BIPOC LGBTQ plus folks. And so within Alabama, we quickly found out, okay, so we're going to have to look at working with HIV/AIDS service organizations, right? Because those, some of those organizations were ones that we heard were more trusted by BIPOC LGBTQ plus folks. So understanding that is going to look different everywhere, and being willing to ask those questions is important. You can go to the next slide. So sometimes folks, as we're working in public health, a lot of times we're focusing on the data, the research. when addressing health disparities. Like I said earlier, nobody knows the community you are working with like the members in it. And so it's very important to listen. It's very important to come together to define and address solutions, reference to these disparities. And also having an awareness that various cultures of a community and other factors are affecting that are affecting diversity must be paramount in the planning, the designing, and the implementing of approaches to engaging community members. Like I said, some folks identify more with their cultural community, their racial or ethnic community, as opposed with the LGBT community. I know I can say as somebody who is living in Mississippi, there are quite a few of the LGBT organizations who you will not find me showing up because they're very white. And that's just not something that I feel that many of those organizations have my best interest at heart or the best interest of BIPOC queer folks. And so understanding, also that a lot of times things happen in folks' lives and, the timeline of organizations, and those folks may not come back. In the general population, a lot of times we think if we put a general invitation, folks are going to come. Right. And that's not necessarily true for BIPOC folks, and it's not necessarily true for queer folks. It takes a little bit longer for people to find out where to go, if this is going to be trustworthy. Right. And so a lot of times the work that we're also doing is in rebuilding the trust that we as folks within public health, we've lost it. Right. We've heard this time and time again, because our country, our public health interventions have not been, the most inclusive at all. And a lot of times have excluded BIPOC folks, have used them for their own benefit and then thrown them away like trash, or have just completely not been inclusive of BIPOC and queer folks whatsoever. And so it's really important that we understand that the work that we are doing is also to rebuild the trust that has been lost. You can go to the next slide. And so as you kind of heard me talk about earlier, LGBTQ plus communities are really going through a lot. And so it's absolutely not surprising that tobacco use and smoking is really rated as a low priority for our community. We've heard this both through surveys and anecdotally when asked about what are the most important health issues that are impacting LGBTQ plus communities, tobacco ranks very low on that list, right? We know that tobacco is an important thing for us to address. With that said, we are not, the work that we're doing and the success that we're going to have is not going to be on telling these communities, no, that's not what you should focus on. You should focus on flavored tobacco. Right? It's important that we say, we care about those things that are affecting your community as well. And so we're willing to show up for that as well. And we're also willing to talk about how we can merge that into addressing health equity disparities and addressing how those intersections meet with tobacco as well. And so when you're working to engage organizations, like I said, a lot of times you're working to rebuild trust. And so we are always remind folks, explore the local history of partnerships. Did this community center have a bad experience partnering with this university or this health department 10 years ago, right? Exploring those experiences are really going to be important to frame how you're going to moving forward, right? And practicing that openness, that transparency, that accountability is always a really good thing to do. You can go to the next slide. I'm gonna kind of move quickly through these last slides around engagement. But as I said, we know that tobacco is not ranked as a top health issue. And so the more that you can really focus on health equity, focus on addressing social drivers, social determinants of health is going to be all the better. And if we're talking about health equity, then we know that health equity as a term does not mean just tobacco, right? This includes things like healthcare, food access, housing, discrimination. And so the more that you can create those linkages, the better the community is going to want to engage your organization or coalition. And the better that they're going to feel that you care about them. For example, we currently are seeing a lot of, this very hateful legislation against our community, and the vast majority targets trans and non-binary youth. So as these policies have passed, continue to pass, we're going to be looking at queer youth, particularly trans and non-binary youth, who don't have access to the gender affirming care that they need to survive, which is going to cause much more stress. And more stress, we know, can lead to youth and young adults and folks choosing unhealthy coping mechanisms like tobacco usage. So it's important that we make those linkages. You can go to the next slide. And so kind of finishing out on engagement strategies, great idea to look at identifying community leaders and champions. Compensating folks is really, really important, and making sure that you're paying folks for the time that they give is important as well. You can go to the next slide. And just a final reminder, community engagement, it's not the extra work, it is the work. And so really ensure that you are making sure that you are that you are prioritizing community engagement is really, really important. Okay, well, that brings me to the end of this presentation. We're going to be sending out a link of resources and different things for you all to look at and view in your own time. A lot of the resources we have at the network and our partners' resources. And so I just want to stop here to take a minute or two for questions. Thank you all so much for, thank you, Margaret, for dropping a couple links in the chat. But yeah, if any folks have any questions, feel free to drop it in the chat or come off mute. I'm happy to also stay back and answer any questions in the chat as well. And you can also, I'll put my email as well up here. It's also going to be in the resources, but I'll drop my email as well here in case any folks want to reach out with specific questions or, anything.